Hi, I'm Hannah Norton, a Reference and Liaison Librarian at the University of Florida Health Science Center Libraries. This video is the third in a four-part series that addresses formulating a clinical question and developing tactics for an optimized literature search. Video 3 discusses how to take a research or clinical question and use it to build an effective search strategy. As discussed in Video 1, you're a healthcare provider and here's your situation. You're seeing a 31-year-old patient in your clinic who has discovered a lump in her breast. After biopsy, the lump tests positive for cancer. Your patient is 18 weeks pregnant, and you wonder what treatment option is optimal for successfully treating the mother while caring for the fetus's health and development. There's a lot of information in that scenario, so how do you get from here to a search strategy that will find a usable number of relevant results? First, develop a clinical question from the scenario, as we did in Video 1. Once you've done that, you can identify the concepts in the question. After you've pulled out the concepts from the question, you need to brainstorm terms, both keywords and subject headings, for each concept. Now that you have multiple terms for each concept, you can think about how to put them together to form your search. The terms that represent each concept can be treated like synonyms and combined with or, while the concepts themselves are combined with and. If you're using the connector not in your search, you can add it at the end. Okay, now that I've summarized each step, I'll go through the process more carefully using our example so that you can see how it works. Based on your scenario or clinical situation, you can formulate a clinical question in order to start searching for the best evidence. In this case, the question we developed in Video 1 is, in breast cancer patients, does chemotherapy compare favorably to surgery with radiation therapy in improving health outcomes for mother and baby? Now that we have a question, we can identify the concepts in the question. Using this sample question, what are the concepts? We can break it down into these main concepts: breast cancer, chemotherapy, radiation, pregnancy second trimester, surgery, and treatment outcomes. Now that we have the concepts, we can think about terms to use for each concept, brainstorm keywords and phrases that would represent the concepts. You can use the MESH browser in PubMed to find relevant medical subject headings, or MESH terms. In the table, you can see that for each concept we have both keywords and MESH terms listed. You will use both keywords and MESH when building your search strategy. In Concept 3, for example, our keyword is chemotherapy, and having searched the MESH browser, we found that some of the appropriate MESH headings are anti-neoplastic agents and anti-neoplastic combined chemotherapy protocols. Now that we've brainstormed some terms to use in the search strategy, we can start thinking about how we need to combine those terms. First, combine synonyms, or the terms you've found for one concept, with the connecting term or. From our example search, we would combine all of our terms for breast cancer with or, all of our terms for chemotherapy with or, all of our terms for surgery with or, all of our terms for pregnancy with or, and all of our terms for outcomes with or. Once we have the terms for each concept combined with or, we can put these in parentheses and then connect the concepts using and, so that each concept is represented in the search. I know there are a lot of terms in this search, so to make it easier to visualize how the search strategy works, the OR connectors are in purple with the AND connectors in light blue. We can see that the OR terms are synonyms, or all represent the same concept, and that the AND terms represent the different concepts we pulled out of our clinical question. Now that we have all the concepts and terms in our search strategy, we can consider if we need to use the term not to exclude any results. You don't use not very often, and usually you add it after you've run the search when you're examining results and find that you want to exclude specific results that include particular terms. In this example, we could use not to exclude either specific animals from our search results or the concept of animals, but it probably isn't necessary for this search. The final search strategy should include the terms you brainstormed and all the concepts in your clinical question, connected using our operators and, or not as appropriate. Remember, or connects similar terms or synonyms and broadens the search, and connects concepts and will narrow the search, while not excludes items from the search. Now that we've covered how to parse a clinical question into concepts, brainstorm terms to represent those concepts, and combine our terms into a search strategy, we'll see how to actually conduct the search in PubMed. But first, if you have any questions about this video, the video series, or searching in general, please contact the library or use our guide, UF Information Resources for Medical Students, to find this and other videos on literature searches, and lots of other resources that are available through UF's Health Science Center libraries.